So we're going to apply the Shockwave now for medial tibial stress syndrome. Quite a tender area, so I'm going to start the bar pressure off nice and low, especially if they're more acute. We can ramp it up later on to see if we can affect that bony tissue if the patient can tolerate it. I'm going to apply 2,000 shocks, and I'm going to use high frequency to try and make it a bit more comfortable to work into. So here we've placed the leg in slight external rotation to expose those lower 2/3 of the tibia, and then we've applied some gel. Working along the side of the tibia there can be excruciating, so I really like to start low and then build the pressure up as the patient tolerates. You can span backwards a little bit to get in some tibialis posterior and also some soleus involvement. Do ensure you're very vigilant with your testing to ensure that you're ruling out stress fractures and advising people accordingly regarding their impact training.